Welcome to Nursing Edge Unscripted Saga, as we use story to connect the past to the present and then our future as we reimagine our teaching and learning. As we celebrate the NLN Year of the Nurse Educator, we pay tribute to extraordinary nurses who've made significant contributions to nursing education. We dive into the stories of nurse educators who recognized a need, challenged traditional customs, and influenced transformative change. Over the past several months, we have focused on the contributions of educators and thoughtful innovators and scholars who played a significant role in the National League for Nursing's curriculum revolution in the late 1980s and 1990s. Over the last 3 episodes, we celebrated the work of one of the most influential nurse educators of the past half-century, Dr. Patricia Benner, Professor Emerita at the University of California, San Francisco, and currently Dean's Scholar at the University of Nevada, Las Vegas. We introduced Dr. Benner's research of the discipline of nursing as part of a series of studies undertaken by the Carnegie Foundation, known as Preparation for the Professions Program. Each of 3 dimensions of professional education and formation were examined within the discipline of nursing. 1, learning of theory and scientific methods. 2, mastery of skillful practice. And 3, the formation of professional identity and agency. Benner and colleagues stressed that all 3 must be integrated and therefore were studied separately and as a whole. Let's turn our attention to some of the key findings of this research outlined in their publication, Educating Nurses, A Call for Radical Transformation. Benner and colleagues strongly advocated for the academic experience to be recreated and used more effectively. They outlined 4 essential shifts that would be necessary to achieve an educational experience that carefully and thoughtfully integrated the 3 apprenticeships. 1, teaching for a sense of salience. The ability to create continuity and coherence in learning is imperative. The requirement for teaching in context, situated cognition, what-if rehearsing, and reflection on learning. While being identified as innovations in teaching today, these innovations were introduced over a decade ago, still essential for use in today's nursing education environments. Number 2, integrative teaching for clinical imagination, thus shifting to a focus on the integration of classroom and clinical teaching, achieved by using multiple teaching strategies that are selected intentionally to produce the intended learning outcome. If integration of thinking and doing is the outcome, the teaching strategy then provides opportunities for the learner to use the content knowledge in the context of practice, such that they are always rehearsing for practice. The 3rd shift takes a deeper dive into the role of educator with a shift to an emphasis on teaching for clinical reasoning and multiple ways of thinking that include being critical. Benner's research and study findings illuminated that thinking like a nurse requires, quote, clinical reasoning, as well as critical, creative, scientific, and formal criterial reasoning, end quote. Number 4, this final shift focused on teaching for moral imagination with a shift from an emphasis on socialization and role to an emphasis on formation, forming their role as a professional nurse. As we look back over a decade and take stock of where we are today, many of these same themes and recommendations continue to be debated and studied. Benner and colleagues' work on the monumental Carnegie study were clear. Improvement cannot be accomplished through curricular and pedagogical efforts alone. Radical shifts and changes in approaches and policy are also necessary. This is a familiar theme for the discipline of nursing over time. Dr. Benner's work made visible the experientially acquired knowledge, skill, ethics, and caring practices embedded in clinical nursing practice. She conceptualized how nurses develop their practice through her novice to expert model. Dr. Benner and colleagues also further provided a blueprint for nursing education transformation in their research on the pedagogy of the nursing profession with the Carnegie Foundation. As we look to the necessary changes being called upon today, may we honor the research and visioning done by thoughtful and brilliant nurse educators like Dr. Benner and her colleagues. May we look back on our not so distant past and consider and learn from our history as we continue to address the necessary changes needed in nursing education to meet the demands of our ever-changing healthcare systems. And so the saga continues, and may our saga continue as we bring to a close this episode of Nursing Edge Unscripted Saga. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.